The proceeding will start shortly. 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 The proceeding will start shortly.
Order, order, and thank you for joining us for today's session on the impact of COVID-19 on new parents, which is following up on the findings of a report we published on the subject just over a year ago. Our report was based on the experiences of new and expectant parents during the first months of the pandemic. They told us their jobs were at risk as they couldn't find childcare, that their mental health had been seriously affected, and that they desperately needed extra help and support. So our report recommended the government take urgent action to safeguard new parents' well-being, their livelihoods and their children's development. So we're holding today's session to find out how the situation for new parents has evolved over the past 12 months and to assess what progress has been made in resolving the problems we identified in our report last year. So we're very pleased to be hearing again from some of the petitioners whose advocacy initially prompted our committee's work on this subject, as well as on behalf of parents, those who are campaigning, and other experts. So to our first two panel members, if you could just briefly introduce yourselves and just say a little bit about what motivated you to start or sign the petitions on the issues that we're discussing today. Shall I come to you first, Bethany?
Yes, that's fine. It's lovely to be with you, Catherine, again. So my name is Bethany Power, and I'm one of those of many that have been affected on maternity leave due to the pandemic. I have carried on campaigning as a volunteer on the matter, and I firsthand started an e-petition with the Parliament that reached over 238,000 signatures. I then carried on being a volunteer and working with many organisations and working with APG called Gaps in Support. I have then attended lots of evident meetings and speaking with the ministers itself, and try to carry on in dealing with the crisis of what's happened to me personally, but also to many other women affected.
Thank you, Bethany, and then to you, Emily.
Hi there, yes, thank you for having me here again. My name's Emily Tredget. I'm a mum of one, and I'm co-founder of Happity, which helps parents find baby and toddler classes to help hopefully reduce loneliness and maintain mental health. I supported Bethany with her amazing campaign, and we also set up a petition particularly focused on getting clear guidelines for the classes, because the government wanted them back, but they weren't, in the most part, being able to return. So it's great to be here today.
Great, thank you very much. So just looking back over the last 12 months, what have been the main challenges about being a parent over this time? Excuse me. Especially during the winter lockdowns. Oh, excuse me.
So shall I answer that?
Thank you. Yeah, go for it, Emily. Yeah,
no, not at all. So we held a survey and recently found that 85% said that their baby or toddler was negatively affected over the last 12 months, or significantly negatively affected. And 90% of the mums and dads said that their mental health was either worse or much worse. So in terms of mental health and baby development, we've seen a real big difference, which is such a shame. We found that 96% of them did want the baby classes to continue if there was a further lockdown, but 56% of them with measures. So it's been a roller coaster for class providers as well. It's been really difficult, with them only making about 86% saying they essentially having to start again, and 63% less revenue than the year before. So it has had a really big impact. We have had some positives. We have been able to speak to ministers and try and help with different bits and pieces, but the overall picture has been pretty negative. I'm sure Bethany's found the same from her personal experience.
Yeah, Bethany, do you want to just answer that question? But also, obviously, during this time, we've had, winter lockdown. We've then had the opening up and the easing of restrictions, and there has been a lot of change over the last 12 months. So how have the different periods over the last 12 months affected you as a parent?
Yes, so I'm going to speak on behalf of myself and how it has affected me. So from July 2020, obviously restrictions were lifted from lockdown 1. Support became slightly better. We've been able to meet a couple of friends and family. However, that only went so far because of the restrictions. Even with the restrictions lifted, I was still unable to go out due to the stress of lengthy queues and no treated facilities, and just because of the social distancing, unable to get the support. Support bubbles were placed in the 9th of September 2020. So it was explained that your household includes a child under the age of 1 or is under the age of 1 up until the 2nd of December 2020. I actually fell out of that because my baby was born the 26th of November. So I actually went through a whole year of getting no support, of being into a bubble, because I was just outside that level. So my baby was 3 months old when lockdown 1 struck. So it was a continuous of heartache of not having support. I had to carry on alone and restless. Since March 2020, I've been able to get no help of health visitor support, even ringing desperately in fear and with problems, even with breastfeeding or feeding. I would have to wait a long time to receive a ring back. I only really had support by actually paying for support with the NCT groups, which were very helpful in trying to battle through. I had to have my son's 1-year assessment done by a video call, which I felt was quite unhelpful, being that I've been trying to deal with my child in being very severe reflux and colic, but also having signs and symptoms in asthma. So then I was also having problems with my GP, and I was then only getting support through actually having to attend to hospital because he was at severe symptoms of the matter. So I had to, with my own health, so I had to have, I had an issue of my labour that caused problems with my healing, and this was delayed because of COVID and the lockdown. So I had misdiagnosed and I had painful suffering throughout a longer time, and I did have some physiotherapy of a women's health physio, but this was done remotely, so this was really unaffected even in my trade of work, working in health and wellbeing sector, dealing with rehabilitation myself. I had delayed mental health support with my PTSD for my labour and with postnatal depression. This experience of no support increased my symptoms, so with the whole pandemic, and having rejections of our recommendations through the Petitions Committee with the government, and speaking with ministers about matters and other organisations speaking about this, it just prolonged it even worse when we were just not being listened to. I did receive counselling through the NHS over the phone. I did actually find that quite helpful in the end, but this was then over a year I was waiting to receive, and I was then referred to the adult mental health service, not specifically to what would be specific for me in dealing with my mental health. So dentistry, I had an exemption certificate, and obviously that runs out after a year. I would have to be in extreme agony to actually get support, and it was by then I was then seeing, but even with trying to prevent the matter in being in the extreme case of symptoms, I had to, I kept begging my dentistry and other dentistry around my area, trying to see me, but I had to then pay privately to actually get seen for checkups. This was pleaded by the government many times that could you at least extend the exemption certificate. This wasn't done. This would have been a very helpful matter, as not just myself, but many people around the UK felt that they had difficulty in using their NHS exemption certificate. With baby classes, I wanted to join, but many I had to pay for. And then due to restrictions, many would then go into virtual classes. So this would take away in you building and bonding with other mothers, but also having a baby at a small age, trying to engage with the TV, found it quite difficult. And whilst you're in a bad mental state, it was very unmotivating to try and be motivated for a class virtually. So it was very difficult. I know before lockdown struck, I actually attended a few community free classes for the health visiting community, and this still now isn't available. So I just feel the lack of support is out there of what it would have been, and the only support you can get is through paying financially, when it's very difficult when you're on maternity on a lower income and then having to face within a pandemic too. So I really hope that when the pandemic is easing and we're living with COVID-19 more freely, I do hope that the government don't just think we don't need community support, because we do. So I was meant to return to work after 9 months of maternity leave, so after statutory maternity pay. This was thought about and planned whilst I was having a baby in pregnancy, and I was speaking to my employer, and this was doable. I was going to return to work on a less hours than what I was on, but I was going to, it was already planned and it was doable. However, due to the pandemic, I was unable to return to work. This was because of childcare. I was unable to get or source of childcare because my baby was an unexisted child within the sector of childcare. So it was an under one. Obviously, there was a crisis in the childcare sector in terms of the ratio numbers, and it was then difficult in finding a childcare when they're at difficulty in staffing too. So I couldn't actually get the childcare place until January 2021. And this was because where I am in Kent, there was a further lockdown from being in tier 4 from actually October. So we're in severe lockdown, and it's only until now with the national government restrictions easing that we're actually coming out of that. So it's been awfully difficult, because then I had to go on, I was forced to unpaid leave. I was unable to get furloughed, even though I'm in the employed sector, and my other colleagues was getting furloughed. However, because I couldn't get the work in the maternity law, I had to then give, I couldn't give, 8 weeks notice to end my maternity leave early. So my employer needed to work within the maternity law, but also give fairness to my actual maternity cover. So I was then, after my maternity, so after 3 months unpaid, taking me up to the 26th of November, I was then able to be put on furlough. However, because my maternity end date was the 26th of November, and then we was able to be put on furlough because it was on national lockdown, I actually lost my accrued annual leave through on my maternity, because it was still in rules that I could use it within the time before the end of the year. However, I was placed on furlough, and you can't use your annual leave on furlough. So I had to lose my annual leave, and I pleaded with the government, and I spoke with Minister Paul Scully, and he understood the matter, but there was nothing done or guidance in resolving matters of mothers like myself. So it was very heartbreaking when, on a financial term, I could have actually used my annual leave if the government actually gave time in saying the furlough was going to be extended, or there was going to be the lockdowns. And I know that's very difficult, but they don't ever think about mothers on maternity leave or needing to return to work. And it's very, very frustrating.
Bethany, it's been quite a year for you. I wanted to just first of all say, you know, it obviously has been a very challenging year, and I think the experiences that you've listed are your particular experience, but I think you do speak for many mothers who will have experienced some, if not all, of those challenges over the last 12 months. You've covered an awful lot of what we would have wanted to ask you about. It was a very, very thorough account of how this has impacted you over the last year. But I'll hand over to Taylor, who I think will have some supplementary questions for you, and also some to Emily as well, about the impact on parent and baby group classes.
Thank you, Chair. Emily, we heard from Bethany's earlier testimony about her experience of accessing parent and baby group classes. Are you able to explain to the committee just what the current situation is for organisers of parent and baby group classes, but also the challenges that you faced, both financially but also practically, in terms of running a class under the restrictions?
Oh, yes, thank you. Yes, it's been a difficult time. It's, I think, a roller coaster is probably how to explain it. Mostly classes have been on and off, and people just haven't really been sure whether they're coming or going, to be honest. And that's been very much down to the lack of guidance, hence our petition. They were allowed for a small amount in November when there was a lockdown, but it wasn't disseminated very well. The government actually relied on us at Happity to tell everyone about it, but there were conflicting other organisations saying different things, and still, even though it was allowed and we were telling people allowed, still councils were shutting them down, which was heartbreaking for providers who had spent a lot of money getting classes up again with lots of cleaning, and for parents who had obviously spent money booking onto them. Right now, it's still very, very confusing. I think at the moment it's 30 people are allowed to attend, not including children under 5 or the worker. And then when you get to singing, it gets much more confusing again. Inside, only 6 people can sing, but it needs to be the same 6. Outside, I think it can be 30, but it then suddenly does or doesn't include children. It's incredibly complicated. And it is really, really difficult. So like I said before, 86% of our class providers have said they're essentially starting their businesses again, which is obviously really, really very tricky for them. The singing is definitely the kind of the example that's kind of stood out is really, really tricky. And I think what we really needed was, and funny enough, it was actually something when I spoke to Paul Scully, I think 2 or 3 times over the last few years. What we needed was, one, to endorse the guidelines that we'd written back in September, or to have a company like ourselves or a regulatory body talking with the government. When I spoke to Paul in January, I think it was, he said that we could have a specific point of contact in the government, just to make sure that when those changes come in, like the singing, when they brought in, I think the singing guideline back in March was that only babies and toddlers could sing and the class provider. Now I know lots of toddlers think they can sing, but babies definitely can't. And so you really do need the parents who are singing quite shyly to their baby on a mat to be able to sing. And because of this lack of feedback route or proper communication, we found that a lot of providers, a lot of parents went through an awful amount of stress, were phoning up the DfE in their thousands, and then a regulation was changed. I think it was about 3 or 4 days later. It was quite quickly. And actually, if they were working with a company such as ourselves to say, okay, this is what we're proposing, what do you think? Can we get feedback? Overall, it would just be much more simple. So it is still quite tricky. That classes are allowed to go back, but there is still a lot of confusion. We did a survey and we said 24% are still very confused as to whether they can go back or not. And some of them are quite traumatized from their experience back in November, where we were telling them we were allowed, the DfE were telling them they were allowed, but still their councils were coming in forcibly in some cases with police shutting them down. And you can imagine, you know, babies and toddlers and new parents, that's not the experience you want. Now in the most cuts, they got apologies afterwards, looking at the regulation, because we did actually get the legislation changed. They were allowed. But obviously that's not an experience that anyone wants to go through. So we do definitely need to look at what we do going forward in case there are further issues. And I definitely think that having one person that can talk with a company such as ourselves that really goes, right, this is what we're planning to do, how will this impact your parents and your providers, and let's make a sensible suggestion going forward. So it's very much still up in the air, but looking on the up, fingers crossed.
We actually did a survey ourselves for parents, and 68% of them found that actually they didn't feel as if they were able to access any group in the past 1 year. And so essentially, how effective do you think the exemption was in terms of, yes, policy wise, the government did say that, you know, groups could hold, but actually in reality, that communication wasn't fed to local councils and organisations who were really the people who had to implement the policy. So from your view, what difference do you think should have happened to prevent such communication mistakes from happening?
Sure. So to start with, the clock just needs to be wound back. So the government actually wanted classes to continue from last summer holidays, but it wasn't until we had our petition, and I spoke to so many different ministers, so many different government departments being passed from pillar to post, because nobody's actually responsible for the baby and toddler sector. For classes. And so I think one big change is there needs to be someone responsible. Even talking like Vicky Ford and Nadine Dorries, it just doesn't fit under their remit. We were just lucky that we found a lovely lady in the DfE who kind of scooped it up and worked on it really, really hard. So that's one thing. The second thing is having really clear guidelines so that providers know what they can do, whether that's endorsing our ones. So in soft play, there's not been this kind of mess as much, because there's the BALPA regulatory board, I think, that had some guidelines which the government endorsed. They literally linked to them from the website. We have those guidelines there. We just need that link, or alternatively, we can help the government in creating their own guidelines and feeding back on them. So I think, and it's really about communication. Like you said, the councils, they weren't aware that they actually were allowed to happen. So we have providers, they had the legislation in their hands, they had our guidelines from Happity, from our newsletter that we sent out to them. They knew that they could run, their insurers might have been okay, but they might phone up their EHO, their environmental health officer, or the council, and they'd say, oh, no, it's not allowed, because they were referring to something else unofficial. And it just became very, very frustrating for them. And we kind of find ourselves suddenly almost becoming this unappointed regulatory board, which is definitely not our expertise, trying to help people, because there are about 12 different pieces of guidelines. So it's one point of contact, one lot of guidelines, and good communication throughout to the council so that everyone knows what they're doing.
Thank you for that. I guess moving forward with Freedom Day coming and lockdown restrictions easing, how do you think this will help to make a difference in the sector in terms of the amount of people they'll be able to attend, but also financially for organisers who've clearly been impacted?
Sure, so it'll definitely help. Like I said, the providers have been 63% on average down on their revenues over the last 12 months. So if they can come back, it will definitely help. But again, it still needs those guidelines if we are going to have differences in any kind of restrictions going forwards. Because I think it was it 24% are still quite confused as to what they can do. And I think it's also about giving confidence to the parents as well. Parents really want these classes, but a lot of them are also quite anxious. So 96% want classes to carry on, even if there's a further lockdown. However, 56 of those still would want some restrictions to make themselves feel safe. And so we just need to be clear as to what is safe and what's going to happen. And there can be some differences. Obviously, our providers will get in touch with people and say what's going to happen in their particular class. But we do need to help alleviate that pressure and that stress on parents, help them understand the importance of baby classes, not only for their mental health and their socialisation, but they develop children through repetition, through socialisation themselves. And if their child's going to go off to nursery, it's really, really important. Our providers have found that a lot of the children coming in aren't as developed as they would expect them to be at the age they come, and in particularly socially. They're hiding behind mum, they're overwhelmed in the classes, they're not wanting to or able to get through the whole class. So it is something that needs to be brought up little by little. But yeah, it's just about everyone understanding what the situation is going to be and how they can be safe. But if we are going to face more lockdowns, we really do, as we've been promised time and time again, to have that one point of contact, the one guideline, so everyone's on a playing level field. Because we found parents across a border, some can go to all the classes they like, on the other side of the border they can't go to any, and we really need to make that clear level. And I'm talking between commercial classes and free classes as well, because unfortunately we are seeing it is those who are from more deprived backgrounds that are finding it much tougher, and we really need to help everyone to find classes that can benefit them and their child for the future.
Absolutely.
Thanks, Emily. Teo, sorry, I was just going to say we're running out of time, so I know you wanted to ask about childcare. Are you happy to go straight to that?
Yes, I would. Bethany, just on childcare, have you been able to access childcare when you needed it since last summer, either from friend or from relatives or from nurseries or from any other provider?
Sorry, your connection broke up, or my connection broke up, so I didn't hear the full question.
Should I repeat that for you?
Yes, please.
I was just asking if you've been able to access childcare if you needed it, either from a family, a relative member, or just from a nursery or another provider.
So in my family, I don't have any family support, so I don't have any grandparents, or my child doesn't have any grandparents, or I have any grandparents, but also friends and family. So my only source of childcare is actually from a nursery or a childminder, and actually finding a child. Sorry if you can see my dog in the background. So my finding a child provider was actually quite difficult, because my child wasn't a pre-existing child, so it took a very, very long time. And because my baby was in a pandemic, we found it very difficult in actually settling into a nursery itself. It took 2 months but also he's never built his immune system. But in actual fact, when I did find a nursery, but also looking to return to work, I found it very challenging because of the childcare costs. So even though we get the tax-free childcare of 20%, but this is capped off £500 every 3 months, or £2 grand a year. If I currently have returned to work on the 2 days a week, trying to smash out all my hours in 2 days, but this is because of the sector I work in health and wellbeing. I can work in NHS or private sector, but I work in private. I've had to return on a contractual part in a 15-hour contract. My P60 was in the 19 to 20 year bracket, was above 40,000. I knew when I wanted to return to work, I was going to take a reduction in hours, but I'm now on £9 grand a year because of the affordability of childcare. So I can't, if I was to work 5 days a week, I'm looking at nearly £4 grand to pay that, and to give up that money freely whilst needing to pay my overheads. I can't give that up freely, even with the government support of the free child tax care. So it's actually made it very, very difficult in finding a child sector, but also trying to return to work. There's been no support. I'm my actual provider or my employee have been very helpful in being flexible and being able to find a suitable part. But because I'm needing to return part-time, there's been opportunities of work far less, and the pay has been complete. I'm looking at a 30 grand a year reduction because of the level of work. Yes, beforehand I was working 7 days or 6 days a week, and I was working, because I deal with rehabilitation and specialise in that. I could work very early and I could work up into the evening. So my work of habit needed to be changed, but I did not expect this. And this is also being based on, I was going to return after 9 months when I still had a business. When I've now returned, because I work in the private sector, I now have returned to work after 17 months because I couldn't return to work because of COVID restrictions. This has depleted my business, this has depleted my position in returning to a job role in what I actually plan to do. This also, because of the affordability of childcare and the hours of childcare too, which is fine, but this obviously you have to work in 2 parts to be able to return to work. So I do feel that there needs to be more government help for a child receiving childcare up until the day that the mother needs to return to work, not just 3 years old, for working families. Working families in today's living, whilst trying to stay away from benefits or housing association, we need help. It's just becoming, more mothers are suffering with career depression and just trying to get a balance into return to work. And it's really affected me and my mental health. And it's just stabbing through not having that support.
Thank you, Bethany. Thank you. You give such a thorough and insightful account of your experience. Thank you so much, and to you, Emily, as well. And thank you again for bringing forward this petition and giving the opportunity for us to look at this on behalf of you and your experiences, but on behalf of all new parents that have clearly had a very challenging year. So thank you very much indeed. We're going to move now to the second panel. So if you'd introduce yourselves, we've got Dr. Sarah McMullen, Sue Armstrong-Brown and Sally Hogg. Hi, so shall I come to you, Sue, first? Would you like to just briefly introduce yourself?
Well, hello, and thank you for inviting me back. I'm Sue Armstrong-Brown. I'm the Chief Executive of Adoption UK, which is the charity that works on behalf of the adoptive and kinship community in the UK. Thank you.
And Dr. McMullen, or are you happy to go by Sarah for this morning?
Certainly am, yes. Hi, I'm Sarah McMullen. I'm Director of Impact and Engagement at NCT, where I have responsibility for all of our volunteering and community support programmes.
Thank you. And Sally?
Hi, I'm Sally Hogg. I'm Head of Policy and Campaigning at the Parent Infant Foundation, and we coordinate the First 1,000 Days movement, which is an alliance of 200 charities and professional bodies that work with families from conception to age 2.
Thank you. So I wanted to ask you all, so if you just indicate if you'd like to come in, and I'll do my best to call you. How do you feel from the work that you've been doing in this sector, that the impact of the pandemic on new children and their new parents and their children has changed over the last 12 months? How do you think it stayed the same? What do you think that was raised 12 months ago that nothing has improved, or it's got better, or perhaps it's got worse? I'd be very interested to hear your perspectives on this. Shall I come to you first, Sally?
Yeah. I think I reread your report last night, and it was shocking how much that we were saying a year ago is sort of still the same a year on. So themes around isolation, which I think Emily and Bethany talked about really well, a lack of support for parents, traumatic experiences at birth, And you know, there's sort of saying that, you know, we've all been in the same storm, but in very different ships, and a story of real inequality, where there are some babies that we're particularly worried about in families where there's adversity, poverty, conflict, and who've been really exposed to that over the last year. In terms of the kind of story of the last year, I think for some families there's been that real accumulation of adversity. They had, you know, perhaps scans where dads were excluded, traumatic birth experiences, and then months of isolation and a lack of professional support. So those experiences have kind of accumulated, and it's been the wait that they've had to have before they've got the support they need has meant that problems have perhaps persisted longer and become more entrenched. We definitely saw some changes over the year in terms of policy. So things like baby groups, having some exemptions in the guidance to be able to keep going. Although, you know, as Emily was saying, because of some of the inconsistencies in the guidance, and because of other things like families having to, you know, professionals having to isolate or having kids at home, or venues not being able to open, although technically some of those groups could run, in reality we know that many of them didn't. So it's been a really worrying time, and many of those things that we were warning about last year when we wrote to your committee and we were saying we're really worried, we know that adversity has an impact on child development, we're now seeing the evidence starting to emerge of the impact that has had. And sadly, we're just going to continue to see some of that stuff become real. We'll see the differences in children's outcomes as they start childcare settings and as they start school, unless we really act now.
Thank you. Have you got something you'd like to add to that, Sue? Oh, Sarah, sorry, did you want to come in?
Yeah, really just to add to everything, endorse everything that Sal's just said there. I think the accumulation of impact for parents has been really, really serious. So whereas when this was being looked at in May last year, parents had perhaps experienced one or two of the, you know, impacts of the pandemic, whether that was the impact on birth and talking about very traumatic experiences, or partners being excluded and having to receive very distressing or difficult news, or go into scans alone after experiencing previous loss. You know, the isolation in the postnatal period, not being able to get support for mental health or breastfeeding support. But what we're seeing now, a year on, is that some parents have experienced all of those things. They started their pregnancy at the beginning of the pandemic, and any one of those would have been difficult, but to put all of those things together and wrap the wider sort of life impact around it, around job security, financial security, bereavement through the pandemic, it's been incredibly challenging. I think you asked a question about some things that perhaps had improved since May. We certainly really welcomed the exemption for parent support in the autumn. So for us as an organisation, with, you know, delivering lots of different types of community support across England, it was really helpful to have that exemption and be able to hang our hat on it, so to speak. So to be able to say, this is how our services are going to operate, this is the exemption it's operating under, and these are the specific bits of the guidance which explain why we're doing it the way we are. And that really helped us to bring some services and support back confidently and to manage expectations around it. But what I would say is, you know, a lot of what Emily said earlier is as an organisation, and this will have been, you know, mirrored in organisations and grassroots community organisations across the country, we were having to piece together different bits of guidance into what it meant for us. So, you know, yes, we were delivering under the parent support exemption, but in a variety of different venue types, community venues, hospitality, etc., different businesses involved around the edges. So it was very difficult. It was a lot of hard work. We were really pleased to work with Breastfeeding Network and Homestar and other organisations to publish some guidance supported by Public Health England. But the complexity of it really did mean that a lot has never come back. And even now we're seeing the local free community support, which is absolutely vital safety net for parents. So much of it hasn't come back, and we're now heading into another period of change without clear guidance.
And Sue, you know, I know you speak on behalf of adoptive parents as well, and so it'd be really helpful to hear from that perspective, you know, whether a lot of these things are similar, but obviously what particular challenges face that group of parents as well.
Thank you, Chair. And yes, it's been fascinating hearing the witnesses today. There are some shared experience with new adoptive families, but there are some really important differences as well. One of the key differences is that most children today are adopted from the care of the state, and usually having been removed from a birth family because of abuse or neglect. So there are really difficult early experiences those children are already dealing with, on top of the disruption of moving homes. Most children come into their adoptive placements at an average age of 3 to 3.5. So we're talking about older children, but we're still talking about new parents and new families, and going through all of those changes from the parents' point of view. What we found last year, and we've just published a big research report following a survey of adopters' experiences during the pandemic. What we found is that surprisingly, there were some families who benefited because of things like school closures, removing that external pressure from children who were struggling with school, but by far the majority found that the pandemic increased the problems that they were dealing with. And very worryingly, one of the things that we saw in newly placed families was an increase in stress, anxiety and symptoms of post-adoption depression, which has another hormonal component, but it does have other mental health components that are similar to postnatal depression. That's gone up to, I'm afraid, 65% of newly placed families reporting that, which is extremely worrying and something that we need to pay close attention to. The main thing that we saw with the characterised newly placed adopters last year was lack of access to support. They were likely to tell us that the support they'd received during their approvals and matching stage was good, and we saw some really interesting improvements in practice from social work settings where they were able to use virtual practice to actually speed up time to matching in some cases, which is really important for the children, because the time they spend in care needs to absolutely be minimised. So that was positive, but then post-placement, we were getting people using words like fallen off a cliff, abandoned and forgotten, very, very difficult accessing support, because face-to-face visits and meetings with social workers, of course, was so difficult last year. And so that's of serious concern. And of course, the exemptions that applied to new parents with babies didn't apply to adopters. So they were cut off as a general rule, not only from key figures in their child's earlier life, and that can be very important in supporting new placements, but also from establishing relationships with new grandparents, from the parents accessing their support networks of family and friends, which is a critical factor. And very importantly, the children, parents reported to us, were missing out on opportunities to socialise, to get used to the idea of safe networks of family and friends around them. And that can have, as Sarah was saying, some really long-term consequences that we're going to see going down the line. The good thing was that government responded with an emergency support fund for adoptive parents of £8 million, with easier access and a wider range of support offers. And the reports we've had about that have been really positive. So I think there's some things to build on there in terms of what does work to support families. But the training courses, the community groups and so on that they would normally have been accessing simply weren't available apart from online. And while that can be very good, it doesn't do the whole job.
Thank you, Sue. I was going to go back, well, I was going to sort of build on what you've described there, Sue, which is very concerning, but also, Sarah, what you mentioned about many of these community support groups still not being back to their pre-pandemic service levels, which, you know, answers the question I was going to ask: are services back to where they were pre-pandemic? And I can see from your faces that they're not. So, I mean, it would just be interesting to hear a bit more about what the current impact of that is, but also, I guess, what do we do about that? Are some of those community groups never going to be able to come back just because of the way things have shifted and changed and structures have changed in the last 12 months? Or, you know, have things changed the way they're provided, so there's more online now rather than physical groups? Or is it something that we really need to look at how we support that redevelopment and regrowth and bringing those back again? It'd be interesting to hear it from from all of your perspectives, and also just on the mental health support side, what help is available now compared to what has not been available over the last year, and just sort of your insights on what probably we need to see in order to catch up on that mental health support that's needed as well. I know that's quite a broad question, but I'll come to you, Sally, if that's okay.
Yeah, so if I talk a bit about what we know from public services, because I think Sarah can talk very well about the grassroots and community service. So we've been doing a lot of work with the LGA local authorities, so I'll talk a bit about what that showed. It was a very mixed picture. One of the things we found was that in local areas where there was a kind of commitment to the first 1,000 days and supporting parents pre-pandemic, and often where there were things like children's centres which brought professionals together with a kind of focus on a place and a community, they were often quite agile in responding to that community's needs in the pandemic. And in some cases that has generated some really good multi-agency working and responsiveness to communities, and some kind of innovative new approaches which will stand them in good stead going forward. So we might see some good models of service delivery on the back of this, but you obviously get the counter to that, which is in the areas where those relationships didn't exist, where there wasn't the buy-in, where the workforce was already so cut back they just weren't there, or they were redeployed during the pandemic as well. You know, things just kind of stopped. There was nothing there. And we're seeing a real struggle in some of those areas to get those services back up and going. You know, the professionals have moved on. They were already stripped right back. The parents, you know, have lost relationships with services, and so there's a kind of reticence to return. Or, people go through this their first 2 years obviously very quickly, and then they move on. So there's a whole group of parents now who have never had experience of going to a children's centre or seeing a health visitor face to face. So they're not coming back to something. They have never had it. The parent, their whole child's life has been in a place where they hadn't got a service they could go to face locally. So it's a very varied picture, which is why national government needs to take this seriously, because we can't let those families down in the local areas where that work didn't happen. One of the things we're particularly concerned about is there has been enormous cuts to funding, particularly public health and non-statutory children's services over recent years. And we've seen people kind of really jump on the fact that virtual service delivery is a cheaper, easier way to deliver services, and parents engage with it over lockdown. So perhaps we can now start delivering more of those services like that going forwards. And actually, we know there are real risks in virtual service delivery. It can work well for some settings and some parents, but to do things like a health visitor check virtually, you can't see a baby. You can't really see that interaction between the parent and the baby, or pick up on some of those cues or physical development needs. Even the most skilled professionals struggle to do that virtually. So there's a real worry that mainstreaming some of those services just because parents connected with them during a lockdown will actually lead to kind of substandard services going forward. We've seen areas, Hampshire is currently cutting 10%, £2 million from their health visiting budget, so they will never return to what there was pre-pandemic. And we know that pre-pandemic wasn't good enough anyway. So there's a real worry that actually some services won't go back to normal for a number of reasons, but because actually there isn't the capacity and the resilience there in the services to do that.
Sorry. Sarah, do you want to come in on that from the community perspective, which you referred to earlier?
Yeah, so thinking about the, absolutely vital community support groups that really are supporting some of the most vulnerable parents that are really struggling to come back. I think it is about valuing and investing in our community support, the power of volunteering, the work that voluntary organisations and charities do. Where we have been able to come back, we've seen the impact of it. So we were able to run walk and talks throughout the winter, throughout the lockdown, and over 41,000 people have attended those walks now. And the impact of that has been immense. We had people attending who were saying they hadn't, in the previous 3 months, a third of them hadn't attended any other support group. They were talking about how it was the first time that baby had looked at another baby or child's face, and that they've been so isolated and really anxious. And it's, you know, reading the stories, you can see, well, it's fantastic we've been able to do this, but this isn't enough. There's so much more that's needed. NCBO snapshot shows, you know, that a lot, I think a third of charities replying to that have talked about their reduction in income. And these are the organisations, whether at local or national level, that are providing so much of that community support. I think Sal's right about the learning about digital. So we hear a lot of people talking about what we've learned, and there's some aspects of being online or digital that have really worked. But we also know that some aspects really haven't worked. Under the parent support exemption, we prioritised, in terms of indoor support, we prioritised bringing back our some of our breastfeeding drop-ins. And I think that's an area where you can see that experiences have been even more challenging than pre-pandemic. There is lots about online support that has worked, some really good learning there, but there's lots that hasn't. And I think it's really important that we learn, that we actually take a look at what has worked online, but also what really hasn't, and make sure as we're bringing services back and redeveloping and trying to make the most of digital, that we don't fall into the trap of keeping too much online and not bringing back the really essential parts of face-to-face support. It's very difficult for parents to have the sort of conversations where they can disclose, be honest, build trusting relationships, talk about their mental health if they're not sitting with somebody.
I was going to, sorry, carry on, Sarah, sorry.
No, I would like to come to the question on mental health, but you might want to finish the discussion on support groups first.
No, that's fine. Why don't you go on to mental health, and then I was going to come to Sue and sort of ask from her perspective as well. But I was also just going to add in a question on, because you mentioned previously as well how complex the regulations have been to navigate, and I'd be interested to know whether the government's current approach in what's about to happen in terms of changes, whether you feel more confident that through the approach that's being certainly that we're expecting to happen from, you know, Monday the 19th, whether that will be a big help to the groups that you work with and the community groups, or whether there are challenges around just simply removing a lot of the requirements, whether that will pose some challenges as well for getting those community groups up and running, whether volunteers will have the confidence to come back to the settings that they may have been operating in previously. Just some insights on that as well. But if you want to touch on the mental health first, that obviously that's a really important part of what we're looking at today.
Yeah, so on the mental health question, we did, so last April 2020, we had some success in securing funding for dedicated postnatal check for women with their GP. Obviously the pandemic was beginning at that point, and so a year on we resurveyed women to see what their experiences of that check had been so far, and we're really disappointed to find that only 15% of women had actually had that dedicated time, and a quarter of them hadn't been asked about their mental health at all. And actually, in comparison to when we did it a year ago, there was an even greater proportion reporting that the focus was fully on baby, which obviously is really important to have, but the focus on mum needs to be alongside that. And that, you know, there's been a recent report from the Maternal Mental Health Alliance as well that I think really demonstrates the impact of this whole period on mental health. And one of the recommendations from the report last year was that there should be some work to really understand the impact, to be able to invest and target support and help this, you know, generation of parents and babies to get the support they need. I think there's a lot of mental health issues that will have gone missed. Your question about next week, Monday, and all of the changes is a good one because it taps into my lived experience of this week, which is spending hours trawling through guidance, refreshing the government website, waiting for the bits of guidance to come through. We're really worried about it. It's really complex. I think we've always known, and people across the sector have said, that it's almost going to be harder to come back in some ways. You know, what the public have heard is an easing of restrictions on Monday and lots just being lifted. But what we can see in the guidance that's appearing is that there's still risk, there's still a need for a really strong focus on risk mitigation. We have a duty of care to our volunteers, practitioners, our staff, and the parents who we're supporting. But we don't have the full guidance published yet to be able to decide how we're operating on Monday. We have thousands of parents across the country in sessions next week. So we're working really rapidly on that. I think we've got a particular concern about pregnant women. So many pregnant women remain unvaccinated or have only had one vaccination. The clinically vulnerable group seems to have vanished from government guidance. We've heard a lot of anxiety about the risks and the lack of protection and support. And you know, we need to think about that and how we're delivering our services, but we also really want to make sure that pregnant women are informed, understand the risks, know how to take care of themselves, feel supported through another period of real anxiety. And I think giving confidence around the vaccination programme is another element of that. So yeah, we certainly don't have what we need. I think there's a lot of confusion across the sector in how we get through this next hurdle.
Next phase. Okay, thank you. And Sue, I'll come to you just generally on whether we're back to pre-pandemic service levels, because obviously you've mentioned some of the government support that you have had specifically for adoptive parents, and just whether you have concerns about still, you know, and how we get to pre-pandemic support levels or better than pre-pandemic support levels really is where we should be aiming.
Well, I think we're certainly trying to aim for better, because we're still in the situation where about 3/4 of adoptive parents are describing a continual struggle to get the support. So there is a very important fund called the Adoption Support Fund, which, where it's accessed, is fantastic, and we get incredible reports of the impact that it has, which shows that if you can apply good quality professional support for families experiencing the effects of early childhood trauma, you get amazing results. So that's definitely there as proof, but it's the demand is outstripping the supply. What we saw in the last year was an emergency measure put in place which increased accessibility and broadened the range of supports that could be offered. The results from that show that that's a really strong set of things to build on, whether they're made available through a continued central fund or through adoption agencies regionally. Either way, we need to see that broader support offer, which also provided support for peer support and community support for families. And as Sarah and Sally have both pointed out, that's really important to be able to access it. So, but at the moment, we haven't had the announcement of the funds this year, and we haven't got any more funding secured for the Adoption Support Fund. It's essential that we get it. So I'd shoot for better. It needs to be long-term, ring-fenced funding, potentially at a higher level. It's currently geared to support for adoptive families and kinship families being the exception. But I think that all the experience we've had shows that it's likely that you will need to provide support for the majority of these families because of their child's early experiences. What we're seeing at the moment, and it plays into both of your support and your mental health questions, is that 70% of families placed last year for adoption did not have a written support plan. So it's completely the opposite to what our experience is telling us, that something like 2/3 of adoptive families are going to need support. So 70% don't have a written support plan, or don't think they have. It might be written, but somewhere in a social work system somewhere, but not somewhere that the parents can see and build on. And even where they exist, there's no duty to provide that support and regularly review the plan. And these are the measures that will make an enormous difference for these vulnerable families. If we're proactively identifying support needs and planning to provide the support on a timely basis, we would see amazing results. At the moment, it's still not happening like that, and we do need to see that improvement. In terms of the mental health, this is where that link lies. What our results found in the survey that we did last year of adopted young people who are not young babies, so adults and late teenagers, telling us that the mental health legacy of those early experiences is profound and very upsetting, has life-altering impacts. So over half of teenagers and young adults, so 16 to 25 age range, accessed mental health services last year. Over half. So we really do need to be putting that early support in place, identifying the need and being ready to provide accessible and timely support. With very young children in the early placement stages, the support needs to go to the parents. They need the support so that they in turn can support the children. As the children get older, and I realise that's outside the scope of this petition, then there's a wider range of things and some more direct work with the children that becomes more and more important. But unless it's planned for at that placement stage, we're going to see the families so much weakened because it's so difficult to just pick up the pieces from early trauma and then parent with love and be able to solve all the problems. It's really not reasonable to expect that to be the case. In terms of where we can pick up with the community support that we can offer, so we did do the switch to online support last year, which has stood us in very good stead because we got thousands of families coming to access training or support groups or webinars, and we're certainly going to continue that. But we, similarly to Sally and Sarah's perspectives, we obviously need to have face-to-face support because there's absolutely no alternative to the benefits that brings. So we need to bring back the face-to-face support when we can, but we're going to need to take quite a cautious approach, partly because of the lack of confidence in adoptive families, in accessing a wide range, and then just the purely business side of investing in provision there without knowing that people will be able to come and use it. So I think we'll be testing the water and finding out where the demand is. At the moment, it looks like the demand is for outdoor meets and activity and family activities. So that feels safer, and then progressing to indoor meets. The exception to that is where it's one-to-one support needs from a vulnerable young person, where again, we need to be able to provide that face-to-face rather than online in the majority of cases.
So that leads me on to the next thing I was going to ask, which is what do you think the government's priorities should be for action? Because I mean, from everything we've heard this morning, my goodness, there are so many different areas that are not where we would like them to be. But obviously, to govern often requires making choices. So, what would you say are the priorities for investment? I guess immediate priorities to sort of try and minimise the impact of the pandemic on new parents and children. Shall I come to you, Sally, first?
Yeah, I mean, I just wanted to sort of link back. We spoke, when you asked about mental health, we spoke a lot about parents' mental health, and there is a lot of evidence about increasing depression and anxiety amongst new parents, but actually I'd like to bring in kind of baby's own mental health into this. So we know that what happens in those first 1,001 days is really critical for later mental health, for your ability to regulate your emotions, to trust other people. All those kind of basic emotional kind of well-being skills and capacities are developed in those first couple of years. And when there is high levels of stress and trauma and adversity in families, then babies' mental health is put at risk. And the families that Sue talked about are obviously the extreme examples of that, where things have gone so wrong that it's identified and babies are removed. But there's obviously a whole, that's the tip of the iceberg. There's a whole iceberg underneath that of babies where they are not getting the care that they need to develop properly. And that early ability, emotional well-being, emotional regulation, those are key skills, not just for later mental health, but for your ability to learn, to socialize, to develop at school, to be physically and mentally healthy. We know that more babies' mental health has been put at risk as a result of the pandemic and the lockdown measures, that all of those risk factors around conflict in families, parental mental health problems, they've all increased, and therefore it's very likely that more babies will be having kind of emotional problems, and their mental health will be put at risk. So we really need the support there for that. This didn't exist before the pandemic. We did a survey recently that showed that only 52% of NHS mental health services would even take a referral for a child under 2, let alone have the support available. So there's a real need to think about the mental health of all babies and young children, but particularly think about good quality services that can identify where there's adversity and act early, because we can do something about that. We know that teams like parent infant relationship services, where there is specialised help, can put families back on track and can empower parents to provide babies with a nurturing the care they need, or can identify early if that baby needs to be removed. But actually, so we need that kind of specialist support. We need to get our universal services back, but actually we need to recognise we've got a traumatised population here, and we know what to do about that. We know how to stop that translating into lifelong adversity, and we need to invest in that. One of the things that government needs to prioritise generally is babies and young children. There's what we've called this baby blind spot in government policy. It really isn't clear where babies sit in government. Increasingly, we've seen in the COVID recovery, DfE have actually explicitly said their COVID recovery package is for 2 to 19-year-olds, and they've got 3.1 billion for 2 to 19-year-olds, nothing for 0 to 2s. They've said it's 2 to 19-year-olds because that is the children whose education they fund, but who is thinking about the well-being and who is thinking about the 0 to 2s? The Best Start for Life review provides a good forward-looking vision for the system for 0 to 2s, but it doesn't talk about what's happening immediately now as part of the COVID recovery system. One of the things that government said back in March when it published the Best Start for Life vision was that it would say who in Cabinet was responsible for the 0 to 2s. We're 4 months on, they haven't even clarified which Cabinet Minister is responsible. So all of these discussions that are currently happening about COVID recovery and lockdown measures and spending decisions, nobody around the Cabinet table has it in their brief to be championing babies and young children. So of course that baby blind spot is continuing, and then we see the ripple effects of that. So there are simple things that government can do just to make sure that babies are, there is someone sat around the Cabinet table championing babies, and then there's a whole ripple effect of policies and spending decisions we might see as a result of that.
Thank you. Sarah, have you got anything to add to that? Or the other thing I was going to ask about was the Early Years Healthy Development Review, and what thoughts were on that, and whether there are things that we could accelerate that's already there to deal with some of the pressures from the pandemic.
And to build, so your first question, to build on what, so endorse again everything Sally was just saying, but to add to that, I think there's a really specific issue in terms of the maternity and health visiting workforce that I think needs really urgent attention. And actually this was here before the pandemic, but it's been massively exacerbated. And I think it's shown, the worst case scenario of what happens when you have an underfunded and under-resourced service. Institute of Health Visiting were reporting 31% reduction in health visitors since 2015 anyway. We had the maternity safety report published last week, asking for urgent investment in the maternity team workforce. I think we've got really overstretched, demoralised workforce, and that, that's not a nice to have, it's an absolute essential for safe care and for that universal safety net that Sal was talking about.
Thank you. Sue, have you got something you'd like to come in on that as well?
Absolutely. So in terms of what we need to see, there's several things, several really important opportunities that could be taken building on the knowledge from the pandemic. Some of it we knew before as well, but we're there now. So it's critical that we do correct that very, very early start problem that we've got with inequity between some new families and others. So we still don't have equal access to parental leave and pay for self-employed adopters and for kinship carers, and that sets them off to a poor start right from the beginning. This was supported in your report last year, so thank you, and we have since then been round the houses with DfE saying it's B's responsibility and B's after 2 meetings, and letters to ministers now saying it's CLG's responsibility. So it's a similar problem. Somebody is responsible for ensuring that people taking children who would otherwise remain in the care of the state do have access to just the same equal entitlement for parental leave and pay, no matter, regardless of their employment status or whether they are adopters or kinship carers. And this is something that we need to fix as soon as possible, because it really doesn't set these families off to a good start. We know in the case of kinship carers, these are friends and family that take a child who would otherwise go into the care of the state and bring them up. 50% of them have to leave their jobs, which is not the deal at all that they should be having to sign up to. And largely speaking, those kinship carers tend to be older, poorer and in worse health. than other parents. So we really should not be abandoning them at the very start of that family's journey. So that's one quick fix that needs to happen as soon as possible. We also need to see the Adoption Support Fund, which is also available to kinship families, shored up, stabilised, and guaranteed ring-fence funding multi-annually guaranteed now. That needs to go into the spending review recommendations and be secured as soon as it can, because it causes all sorts of problems planning for support. And finally, we do need to see every child that's placed in a family when it leaves care coming with a properly multidisciplinary support plan provided to the parents or the carers, and regularly reviewed with a commitment to fund that care that they need. Otherwise, we're going to see those families having more and more escalating problems, which usually only get addressed as crisis nears, by which time that they have really affected the life chances of the children involved, and also the parents. So we need to see that proactively planned for at an early stage, so that children who've experienced early trauma are put into homes that have the best chance of being stable and being happy and able to allow those children to thrive and flourish as they deserve. We know all this, and those are the solutions that we need to see put in place.
Thank you, Sue. I just wanted to clarify something that you said, that one of the challenges that you faced is the departmental responsibility for reforming parental leave and pay. And I know that the government is going to produce its review of options, but you mentioned that currently it's your impression that the responsibility has been handed to, was it MHCLG, you said? The Department for Local Government?
Yes, well, we haven't spoken to them yet. We've been speaking to Bees. DfE advised us that this is a Bees matter. So we've had 2 meetings with them, who have reviewed it and then advised that it is not within their scope, because they have to deal with entitlements that come via an employment relationship, and where a family is self-employed, a parent is self-employed, there is no employer relationship, and therefore it's a matter for local authorities. So it's basically going around the houses with no one taking responsibility.
Okay, that's very helpful to have clarified, and we'll take that up. And what have you seen any progress on this issue, or is it just going around the house? I was going to ask you what progress.
And it's been raised multiple times over years. It's never been taken ownership of anywhere in government. So no, we're not seeing progress. We're very unsatisfied with the way these families have been treated.
Okay, that's helpful to have clarified. Thank you, Sue. And just going back to Sarah, I think I raised this particularly with you in terms of the changes that are coming up, and you know, obviously I don't want to make you relive obviously what a challenging week you've had. But what do you have particular concerns for, or have you sort of become aware of particular concerns for women who are pregnant or breastfeeding, in terms of not just returning to community groups, but also returning to work, and what sort of challenges around that you have been made aware of?
Yeah, I think it's a really good question. I was going to add to everything that's just been said. There's some aspects of what we're talking about and learning about right now which are really urgent. We you know, yes, restrictions are easing, but this pandemic is not over. The anxiety and fear that we felt in that first 3 months, we can see is starting to come back, not as universally, but really, you know, we're being inundated with questions and concerns about what it all means for pregnant women. And they're worried about lack of protection in the workspace, going about their daily lives. Are they going to have to shut themselves away? Or potentially not worried, actually, because there hasn't been, you know, as we're moving into this different stage, there hasn't been any clear messaging for that group to help inform their decisions. So this big focus on personal choice is all very well, but if you're vulnerable and you don't have the information and support available to you to you know, to follow through on that, it puts people in a really, really difficult position. We're still waiting. I refreshed before we started this morning. I'll be refreshing afterwards. We're still waiting for the Working Safely and guidance for employers to be published for Monday. this is really urgent stuff. And I think pregnant women are being put in a really difficult place, as are the employers who have a duty of care. We really need clear guidance on this. We should have learned this lesson from the previous stages.
And what would be your key asks if they could be presented to government? Would it be prioritisation for vaccine? Obviously, you would like clarity on the guidance, but what are you hoping to see in that guidance that we could put that? Obviously you've got this voice today. What is it you're hoping to see in that guidance that is clarified?
So prioritisation for vaccination, we really would have liked to see. So that is an ask. We wish that had happened a couple of months ago, given where we're heading now. Also, clear guidance for employers. We're looking forward to hearing from Royal College of Obs and Gynae, who I have to say have been absolutely brilliant through the pandemic in providing really clear and consistent guidance and updating it regularly throughout. But their guidance, I think, is going to be really key in whether employers should still be continuing with the protection for pregnant women, particularly in their third trimester when they're more at risk. So we want to see that clarified and that protection put in place.
Thank you. I can see you nodding, Sally. Have you got something you'd like to come back in on that, or anything to add that you think we haven't covered in this section of this panel section?
I think there's just the concern about the invisible children. So there are the way services are structured generally in the first 2 years of life. You get a lot of contact with services in the first few weeks, and then it sort of gradually declines, and actually there is no contact with families from 12 to 24 months. There's a health visiting check at 9 to 12 months and one at 2.5. No one is checking up on those children, and often the services that might be there for them, children's centres and things, have been cut. And we're in a place where there'll be families who've had that adversity that we've talked about, parental mental health problems, suddenly huge increases in anxiety, again for all of the reasons that Sarah's just said around not being clear about whether they can go out safely and who is going to know about those families? Who's going to know about a child who has spent their whole life in substandard accommodation with relationship conflict, with parents with poor mental health, who maybe had one phone call from a health visitor when they were 9 to 12 months old, who the parent had never met face to face, so wasn't able to be open with, and that's it. So there's a huge need to mobilise public services and voluntary sector services and communities to ensure that we don't lose those invisible children. We don't only find out about them when there's serious incidents or kind of later down the line, and that requires investment, it requires valuing that, it requires focusing on that, and it requires some really urgent action, and we're not seeing any of that at the moment. So there really is a need. 3.1 billion for 2 to 19-year-olds, all of that action for school. We need the same level of investment, of focus, of kind of whole system drive towards the youngest children.
So are you suggesting, because obviously we put in our report, one of our recommendations was a catch-up fund for health visiting. Are you suggesting that even if families, babies have had an online check at some point in the last 12 months, that actually that physical check that normally happens should happen ideally in the next year? And obviously there's a whole new cohort of mothers and baby coming through, so that would require additional investment to almost double those checks within that 12-month period. Is that what you're suggesting ideally would happen?
Yeah, I think some local authorities have found really creative and innovative ways of kind of making this happen. So it doesn't necessarily have to be a health visitor. There are some lovely examples of early years workers and people at Home Start volunteers and health visitors working together to share that information. But it requires that kind of joint system approach to make sure that people know what they don't know. So we've heard from local authorities where they have shared information about the children that haven't been seen, or or that have gone without a check for, you know, and they're moving their 2.5-year-old checks forward. So they're seeing the children in the first year and perhaps asking family support workers or home support workers to visit the children. So it's not an official health visiting check, but at least it's eyes on the family and an opportunity. I think, you know, we need to act quickly here. So we need to give local authorities and CCGs and the voluntary sector some flexibility to use the resources they have. But there needs to be an injection of both resource, but also that kind of direction and leadership to really make sure this happens.
Okay, thank you. And Sue, I'll come to you. I don't know if you have anything specific to the group of parents that you're speaking on behalf of in terms of that would sort of add to the, or, you know, the anxieties around the changes that are coming, but you know, obviously, you know, is there anything that you would add to that, and also anything else you would like to say as we come to the end of this panel that we haven't covered?
Thank you very much, I appreciate it. For children who've undergone instability in their early lives, stability is everything. And of course, the fact that we've been through the 18 months that we've been through has been deeply unsettling for most of us, not just this group of families. But everything that is put in place to follow is to have an eye on that. So the supported transit, the investments in schools have been mentioned. We really do need to capitalise on the new awareness of the impact of all the things that have happened during the pandemic on everybody's mental health and everybody's well-being. We need to capitalise on that and make that real in the policy decisions that are made about recovery. So attainment should not be the be-all and end-all in schools, for example, when we're talking about the children, all children who've gone through the pandemic. We need to be thinking about well-being, socialisation, ability to regulate, ability to form relationships and build social skills as the absolutely highest priority. And once we prioritise that and things like inclusion, attainment will follow. And that needs to be the way around we think about everything coming out of the pandemic. Thinking particularly about that, I loved your baby blindness phrase. I hadn't heard it before, but I do recognise what you're talking about. Thinking about those families, the care review is a really significant opportunity to rethink how families who are experiencing difficulties are supported. There's an emphasis in the thinking in the care review on preventing families from coming into care in the first place by providing much better support to families who are struggling and their children earlier. And I do think that's one that we can all engage with equally. In terms of the very young children in adoptive and kinship care placements, it's exactly the same set of challenges when you beyond the reasons for them being in those placements. And one of the things that our data shows over and over is if you can put in an ounce of early intervention for therapeutic parenting support, you save £1 of later crisis. And that's a reflection generally that I'd like to see being taken up going forward. So I'd like to see adoption agencies being encouraged to put in place early, universal and community support for adoptive families at an early stage, and not just waiting until we need clinical therapeutic support when they hit crisis point. So there's all these stabilising measures that we could do a lot more with and that would really pay dividends. Thank you.
And so that's all we've got time for with this panel, but thank you so much. It's been an incredibly enlightening and a rich session of evidence, and I'm sure there's much we can work on in terms of how we take these issues forward. So thank you very much for the evidence that you've given today. We'll now go to our third panel, who I will ask to very briefly introduce yourselves if you can. Neil, could you introduce yourself first, please?
Of course, by all means. Neil Leitch, I'm the Chief Executive of the Early Years Alliance. We are a membership organisation representing childminders, nurseries, preschools in England, and we also operate 65 settings ourselves in areas of deprivation. So we experience firsthand some of the challenges of being an operator.
Thank you, Neil. And Joeli, I'll come to you.
Morning, Catherine. I'm Joeli Brearley. I'm the founder and director of Pregnant Then Screwed. We're a group of women who have lived experience of pregnancy and maternity discrimination, and a charity which seeks to end the motherhood penalty.
Thank you. And Rosalind?
Good morning. I'm Ros Bragg. I'm the Director of Maternity Action. Maternity Action is a charity which delivers advice on maternity rights and supports all pregnant women, new mothers and their parents to protect and strengthen rights in the areas of employment, social security and healthcare.
Great, thank you. And thank you all for being here today. So I'll hand over to Jonathan, I think, who's going to ask the first few questions.
Thank you so much, Chair. And this is to Ros and Joeli. So pregnant women were classed as clinically vulnerable at the start of the pandemic. But in our inquiry last year, we heard some employers weren't meeting their health and safety obligations to these women, in particular not suspending them on full pay if needed. Is this still a concern? And if I go to Ros first.
This is definitely still a concern. Roughly a quarter of all calls to our advice lines since the pandemic began have been from women concerned about poor health and safety at work. As you said, pregnant women are classed as a vulnerable group. The evidence shows that pregnant women are at increased risk of premature birth. Women more than 28 weeks pregnant or with an underlying health condition are at significantly increased risk of hospitalisation and death. So it's a group with well-founded concerns about the risk of infection. But for women, particularly in frontline roles, health and safety management has been consistently poor throughout the pandemic. Unsatisfactory risk assessments, unsatisfactory mitigation measures. It's certainly our view that women should be placed on maternity suspension or removed from frontline roles from 28 weeks or where there's an underlying health condition, but this is very unusual to see in practice. We continue to hear from women in care work, childcare, teaching and other public-facing roles who are required to continue working in those roles throughout their pregnancy. I think there's a big problem with the health and safety executive and local authorities who are not offering effective enforcement in this area, and this leaves it to women to pursue employment tribunal claims if they want to assert their health and safety rights, which obviously doesn't work for most women. And the response to that for most women is to commence maternity leave early, to take unpaid leave or statutory sick pay. And if you take unpaid leave or statutory sick pay, that significantly impacts on women's incomes, and depending on the timing can mean that they're not entitled to statutory maternity pay. The government has released guidance on health and safety for pregnant women, but it hasn't been widely publicised. And I think due to the lack of enforcement measures, a lot of employers are treating this guidance as optional. Given how widespread and unsatisfactory the management of health and safety for pregnant women has been throughout the pandemic and the significant risks which women are facing, we're asking the government to extend furlough or a similar provision to cover the cost of maternity suspension from 28 weeks, or women have underlying health conditions, which is a model that could be extended to other clinically vulnerable groups. What is clear is that the current arrangements are putting women at significant risk.
Joeli, before I come to you, because it's just to sort of give you something else, because my partner is a school teacher. She was pregnant just and was due, in March, and obviously we then in March 2020, God, it feels so long ago, doesn't it? When obviously we were suddenly sent home, and I remember her employer, she's very lucky to work in a school, so therefore, unlike, because it's public sector, there's much more, I feel like, rigour probably, and to a certain extent, around the protection of these kind of rights. And so my partner was sent home, obviously was on full pay. Then when it came to maternity, received a maternity pay. We're very grateful. And I imagine that there was quite a lot, Joeli, of women who fell into a trap of working on the front line. Obviously, at the time, we didn't know the risk to pregnant women or to fetuses from COVID. And so some harsh decisions were made, probably against those women, I suspect, or with employers who maybe weren't fair. Is that, do you reckon, a fair summation of what went on in the system? Or do you think that that's probably a bit simplistic?
I think different women have had different experiences. We've heard from lots of teachers who've had a terrible experience and were suspended from work and have been placed in classrooms with children in close contact with children, and have had a very difficult time. We've been collecting data on this throughout the pandemic, so I can tell you very clearly that back in April 2020, 76% of pregnant women who worked outside of the home had been suspended from work on safety grounds. Their experiences were very different, as Ros has said. Some were suspended on the correct terms, but very few. The majority were suspended on incorrect terms because the information was not clear. The government was not giving information on what should happen to pregnant women. It took the government 9 months to publish any safety guidance for pregnant women whatsoever that appeared in December 2020, and it is still not clear. The guidance says that all pregnant women should have a risk assessment, and if that risk assessment says that they're safe to work, they can continue to do so, but it doesn't stipulate what that risk assessment should contain. So our research in April 2021, when we surveyed 3,600 pregnant women, found that 4%, only 4% now are being suspended from work on safety grounds. So we've gone from 76% to only 4%, and less than half of pregnant women who are working outside the home have had a risk assessment done and their employer is following it. So despite this guidance being published saying, employers, if you employ a pregnant woman, you must risk assess them, it's not been done. And even when it is being done, it's often not being followed. And pregnant women have no information where they can go to their employer and say, this is what you should be doing to protect me. This is how I should be protected, which is leaving them very vulnerable.
So you would say, Joeli, sorry, so you would say pregnant women have been treated as they've been a forgotten cohort, if I can use that term loosely, without this pandemic?
That is absolutely what I would say. And not just in safety at work. I mean, we'll come on to talk about vaccines, and I do want to quickly touch on hospital restrictions, but they have just been completely forgotten and continue to be.
No, and out of interest, Joeli, I was wondering, do you know, or do we know how many women have missed out on their full statutory maternity pay entitlement due to incorrect action by their employer during the pandemic? Do we have any figures? And obviously Ros may have some as well.
I can tell you, no, I can't give you data specifically on that. Ros may know better than me.
I'd like to be able to give you figures on that, but so far as we're aware, that hasn't been collected. It's been, we've got massive gaps in the data collection around maternity, paternity, parental pay and leave across the board. And I think we've seen a drop in take-up of maternity allowance and so on, but we just don't know how these have played out in practice. There's a data gap there.
So I think it's quite clear there, isn't it, that, and Joeli, you were just saying that the guidance is still not clear. So I suppose if I put the question back to you on this, then what does the government need to do, and how quickly does it need to do it in order to make sure that employers are aware of their obligations to pregnant employees in the context of the pandemic, and obviously particularly now with the easing of restrictions, how that there is still going to need, obviously we're still asking for common sense to prevail in all this and people to use their judgment and employers to use their judgment smartly. What do you think the government needs to do, and what maybe could employers do as well in the short term?
So the government needs to, we support the guidance which says a pregnant woman should be risk assessed. The guidance needs to stipulate what that risk assessment should contain. Should pregnant women now being able to socially distance, being able to remain 2 meters away from all other people at all times, plus PPE, we need that very clear information. We think the Health and Safety Executive, as Ros said, we don't think that they're doing enough. We did a freedom of information request with them in November 2020, and they confirmed that no formal enforcement action had been recorded with regards to the safety of pregnant women and new mums, yet both Maternity Action and Pregnant Then Screwed were being inundated with calls from frantic pregnant women who were terrified for their safety. So we'd like to see that guidance for it to be much more clear and promoted. So we want to see a marketing campaign, essentially, to say to employers, you now need to really be looking after your pregnant workforce.
So Joeli, and before I come back to you, Ros, I would just say, I want to, give my full support to the idea of pregnant women out there. And I say that because, as I say, my partner was pregnant. We had our child, Amelia, in August of 2020. I've never been so scared, and that was me. I'm not the one carrying our daughter at the time, and I've never seen my partner, to be quite frank, so scared. Because obviously, as you said, the data just wasn't out there about what COVID could do to a pregnant woman or to a fetus. And I still remember it. Every time we left the house, even going to the supermarket was a stressful journey, debating whether or not to do it. Because obviously getting an online booking was a nightmare, and I suspect that was probably another fall in the system, that when we had, obviously clearly the clinically vulnerable needed those appointments to be able to get supermarket shops, but when we didn't know the risk to pregnant women who were considered a high risk category, a pregnant woman wasn't able to necessarily book unless she had a pre-existing account, maybe with a Tesco or Sainsbury's, to get an online slot, and therefore was having to make a very difficult decision about whether or not to go into a supermarket to shop. But Ros, sorry, I did see your hand up, so I will let you come back.
Yes, you'd asked about what needed to be done to ensure employers are actually following good health and safety practice. I think the guidance is only ever going to be one small part of this picture. The biggest problem we have is employers just disregarding it. So good guidance is all very well and good, but if employers choose not to follow it, it's really about enforcement. And the health and safety executive and local authorities are supposed to play a role in that. They're really not doing that work. I think the idea that a woman has to take her employer to the employment tribunal in order to arrange basic health and safety protections is, it's a guarantee that women won't have the health and safety protections that they need. So what we've been proposing is, and alongside the Royal College of Midwives and the Royal College of Obstetricians and Gynaecologists, is for the government to support employers to put women on maternity suspension from 28 weeks or where there's an underlying health condition that removes the financial barrier to putting women on maternity suspension. I think will be incredibly helpful in terms of providing women at the highest risk with some basic health and safety protections.
I have two final questions, if I may, and I think what the statistics I'm about to read out will probably stack with all you've been saying, which is we had a survey as a committee ahead of this session, and only 28% of new parents who had returned or planned to return to work felt their employer giving them appropriate support and guidance. So do you feel the government is doing enough to communicate the options available to new and expectant mothers currently returning to work and their employers?
No.
I love blunt answers, Joeli. That's fantastic. I'll tell you what, Catherine's been in the house a lot longer than I. One-word answers can be very powerful at times. I think we'll have to quote that when we do a session in the chamber on this stuff. No, fantastic. And then, do you think, therefore, obviously, Ros, you mentioned some ideas about obviously the financial situation, to support parents and support businesses as well, and how that can work. Do you guys believe that furlough is still a valuable option for new parents and their employers in this situation? Therefore, should there be an extension of furlough, in your opinion, maybe particularly to this specific group, if we're not going to carry out broadly as we are doing at the moment to the end of September?
I can respond on that if you'd like.
Please do.
Furlough scheme has been very helpful for many pregnant women and new parents, but there is no mention in the scheme of pregnant women. And the result of that, is many employers have simply not offered furlough to women who would benefit from it. And it is quite extraordinary that we are at this stage and still have no mention of pregnant women in that scheme. I'd mentioned our proposal, which we made along with the Royal College of Midwives and Royal College of Obstetricians and Gynaecologists for a furlough scheme or a similar arrangement to support maternity suspensions. I think that is absolutely critical now that the economy is opening up and more women will be invited back to frontline roles. But I would also add that in terms of return to work, we're continuing to see a lot of women with flexible working requests being refused. This was much more manageable while women were working from home or had been furloughed. And what we're finding astounding is that we're seeing women whose flexible working requests are being refused for very minor requests, not 5 days a week working from home, but maybe a half-hour change in start or finish times. And this is after employers have seen just how straightforward it is to operate flexible working arrangements with their staff. So I do think that in terms of supporting the return to work, there are factors alongside the furlough scheme which need to be looked at in order to ensure that we don't lose large numbers of mothers from the workplace due to very poorly managed shifts from the restrictions through to the opening up of the economy.
And out of interest, sorry, Chair, I'll just my final one. Early year settings obviously have taken a battering throughout the pandemic. Obviously, some are not financially able to remain open. Some have had to close when we've obviously had a COVID outbreak, and obviously then that's not even factoring in the increasing absences from schools at the moment, which is petrifying me and the Chair, I'm sure, for our constituency's perspectives and the future of those young people's lives. Obviously, when we talk about young people not being in school, we sometimes can forget, can't we, mothers in particular, who then carry the burden of then having to then isolate and obviously potentially take time off work. Out of interest, I don't know if you've had any opinions on that as well, and what support has been in place for mothers throughout the pandemic when they've had to obviously self-isolate or be at home with their child due to a lack of childcare options because of the pandemic.
Yeah, we ran a campaign with Gingerbread on this because there were lots of parents who were forced to not work for a couple of weeks because they had to obviously stay home with their children and homeschool. And in response to that, there was a grant issued for parents who are on low incomes, a £500 grant, parent isolation grant. But it was affecting people that weren't just on those very, very low incomes, which is, the threshold was really hard to access that grant. So it has really affected certainly the income of predominantly mothers, and it's also meant some mothers have lost their jobs as a result. I can't give you the exact data on that. We do actually have that. We've collected data on that issue, but we know that mothers particularly have had to leave their jobs as a result of some of those issues.
Joeli, if I may, Chair, would you be acceptable for that data to be written into us so we could put that as part of our submission, if that was okay?
Yes, that'd be very helpful. Thank you. If you'd be happy to provide that, that'd be great.
Thank you very much, Chair. I'm happy to hand back to you.
Thanks very much, Jonathan. Thank you indeed. So we've got such a huge amount to cover here in terms of the impact on parents and pregnant women and returning to work. Have you seen evidence that women have been disproportionately affected by redundancies over the past year? And I'd be interested to know what feedback you've had from the women that have contacted you about how they've managed that, because I think many are recommended to go to ACAS for conciliation, and that's what the government has said that people can do if they feel unfairly treated during this period. And I know you said, Rosalind, that basically that is one-way ticket to employers not implementing the required health and safety checks, and by putting that burden on the employees to seek the advice and to make that challenge and to get support from ACAS or to go to an employment tribunal. Just in practical terms, how do you think this year has been for new parents or pregnant women who have been affected by the pandemic and potentially redundancy as well?
There's been extremely high levels of calls to our advice line from women affected by redundancy, and we're consistently hearing of redundancies which are profoundly unfair. A woman made redundant while her maternity cover is kept on, a number of redundancies being made when a business downsizes, all the women with children or who are pregnant somehow finding themselves into that group who are being made redundant. It's a huge problem. And the existing legal framework does not protect these women. The Regulation 10 protections will only help women if there is a suitable alternative job available that they can be placed in. What we're dealing with is businesses downsizing, so there are very rarely suitable alternative jobs. And of course, there is protection against discrimination, but it's extraordinarily hard to prove. This is one of the most difficult things to pursue in the employment tribunal. Time-consuming, expensive, and often the evidence you need is from other people who are trying to keep their job. So what we have is a legal framework that doesn't work. So consequently, sending women off to ACAS is placing them in a very difficult position because they simply cannot resolve the cases through the laws that currently exist. What we've been arguing for is stronger legal protections, and the government indeed committed to make stronger legal protections back in 2017. And And Maria Miller MP has produced a bill which would provide stronger legal protections. And I think there's an urgent need for government to adopt that bill so that we can provide women with the protections they need right now. This bill would prohibit redundancies for pregnant women and new mothers except in very limited circumstances. That's effective protection against redundancy. It would mean that referring women onto ACAS could give you a result, whereas at the moment, the protections are so weak that referring onto ACAS is unlikely to get a result. And indeed, the government's suggestion to extend the timeframes in which current Regulation 10 protections apply will also leave women being referred to ACAS and unable to get a result. So we do think that the situation is really quite desperate. We're seeing large numbers of women forced out of the workforce through unfair treatment, unfair redundancies.
As you know, you may know, I raised this directly with the Prime Minister in terms of the pledge that was made and when that's going to be delivered, and awaiting a written response on that. But in the meantime, we're obviously facing in September potentially the end of furlough, and we may well see a spike in the challenge around this. Is that something that you share concerns over, and what would you like to see? You know, obviously you want to see the protection within the law strengthened, but is there something in terms of the handling of the pandemic as well that the government could do to support? Joeli, shall I come to you on that one? Or
yeah, I mean, just to add to some of the things that Ros said, which obviously I echo entirely. We did some research in July 2020 with 20,000 mothers, and 15% of mothers either had been made redundant or expected to be made redundant, and just under half, 47%, said the reason they thought they were going to be made redundant was because of childcare issues. And that's illegal. You can't shove somebody out of their job because of childcare issues. But these women were very clear that that was the reason why they were going to be pushed out of their jobs. In April 2021, we did some research with 16,000 mothers and found that 30% of them said they'd faced discrimination during the pandemic, and 22% of mothers said they'd been overlooked for promotion. So there are big issues happening here, and we believe that the government needs to, as well as extending and strengthening those redundancy protections, they need to extend the time limit to raise a tribunal claim. We know that it's very, as Ros has outlined, only 1% of women even raise a tribunal claim. Before the pandemic, it was so difficult to do. Those waiting times have enormously increased. Those barriers to accessing justice have enormously increased. So we need to, the bare minimum we need to do is increase the time that they have to be able to raise that claim. And we also, the government did make a commitment to rerun the research they did in 2016 on this issue, that the Equality and Human Rights Commission produced the most robust research we have in pregnancy and maternity discrimination. It's now 5 years out of date. We need to know what we're dealing with. We need to know what the picture is. So the government needs to commit to rerunning that research as a matter of urgency.
Okay, thank you. So you mentioned, Joeli, that a number of mothers do feel very clearly that they have been made redundant because of childcare issues. So I was going to come to you, Neil, on that, because to what extent have childcare services returned to pre-pandemic levels of activity and availability?
Well, they haven't, and that's the reality. The comment within the committee room just a moment ago that said settings are taking a battering, that was another statement that I think should be referenced within your report, if I may suggest that, because that is the case. And I heard loud and clear Bethany's earlier comments about affordability and access, and obviously just then Joeli's comments in terms of her research. If I may, I just wanted to explain why I think that is a challenge, and it's moving forward, a challenge moving forward, which is not likely to get better. And that is to say that, you know, we were already in a precarious position. You know, pre-pandemic, basically, we struggled, systemic underfunding, and it's caused major, major concerns. Throughout the pandemic, I have to say the sector feels it was treated as a really, really poor relation. When it came to sort of policies regarding testing, whether it was about PPE, whether it was even the recovery, whether it was about paying for absences, all that money went to schools, and I'm not criticising schools, but again, other colleagues have made comments that in terms of the early years, it seems to be a blind spot. We seem to be, as I say, I think we're almost treated as babysitters and not part of the education system. And why I think this will just continue is I want to go back to, just if I may, the freedom of information request that we put in back in, dare I say, December 2018, when we were sort of tired of constantly being told that this government invests more than any others, you're paid enough money for the free, what's so-called free entitlement, and therefore this isn't a problem. So we asked for the computations. We said, if you're confident that's the case, show us your narrative, show us the rationale as to how you arrive at these figures. And we were rejected in terms of an FOI. So we went to the Information Commissioner's office, who ruled in our favour. 2.5 years later, we get that data, and we've got that information. And I can tell you why they delayed providing that information, because it is shameful. We have a position whereby, and this is government's own data, back in 2015, they said that they would need an additional £2 billion to fully fund, their words, not mine, the early years sector, and something it described as unaffordable. So what it proposed to sort of balance the books, rather than invest this amount of money, they said that we will make them work to maximum ratios, them being basically providers. And that, of course, for parents, has stripped out the margin. We don't have the capacity to deal with all the challenges that are coming this way in terms of children's development throughout the pandemic. We have no margin whatsoever. So we can't deal with a child on a one-to-one basis if that is needed. The other thing that they said is that they recognized that this would push up, and this goes back to Bethany's initial point, they would push up the fees to parents who have children under the age of 3 by up to 30%. And they acknowledged that would be the case. So again, you know, why would you do that if you really valued the early years sector? And to put that into context, again, government's own figures, their data that they had to give to us said by 2021, the cost of delivering 1 hour of childcare for a 3 and 4-year-old would be £7.49. That's what they estimated it would be. What did we get at that particular point on average? £4.89. So, you know, we are a mile apart. Come back to your question on basically, have we recovered? Yesterday, I think it was yesterday, the Department for Education released its figures on attendance levels. 76%. So we're only 3/4 of the way in terms of attendance levels. And I think it's important to understand that is an incredibly, or it could be an incredibly misleading figure, because what it does is it doesn't talk about occupancy. It says, for example, if a child attended on a Monday and they only attended for 2 hours, but previously, last year, they attended for 6 hours, it still records them as being there in that place. So what it doesn't give you is the nuance of how many hours are they taking? How many parents have reduced the number of hours, basically, that they take within a setting, particularly when it comes to paid for hours, which frankly keeps most settings alive. Given what I just said about cross-subsidising, that's what keeps settings alive. So yeah, I do think we've got a major challenge ahead. It will not get better. And what we are likely to do, just one final point, if I may, Catherine. What we're likely to do is to jeopardise those providers in areas of deprivation, where you would argue the biggest return on social capital investment is going to be there. They're the areas where people will close. This time 2 years ago, we had 130 settings. We operate wholly and exclusively in those areas. Today, we have 65, half of our complement. That's the consequences of underfunding and pretending that you adequately fund the sector.
Thank you, Neil. And what I was going to ask was, do you have that occupancy figure, or is that not something that you are able to collect?
Well, we would suggest to the DfE that they should improve their data collection.
Yeah.
It's interesting that yesterday, alongside those statistics, came a request as to whether they should now drop collecting those statistics. My suggestion is you should improve collecting those statistics, not drop them.
Okay, thank you. And with the end of furlough in sight, is that a big concern for the childcare sector as well in particular?
Well, I think it will be, because the level of redundancies at this particular point in time, it's an unknown figure, so that may impact on settings. I think the fact of hybrid working, more and more employers starting to have employees work from home, is likely to impact on settings. And this is about the long-term viability of the early years sector. So if a setting cannot financially make it work, it will go by the wayside. Anyway, I think what's critical to remember is this isn't just about, and it shouldn't be about, getting predominantly mums back into work. This is about child development. This is about education. My point right at the beginning is that this should be about educating our children. So it's, you know, even if you're working at home 2 days a week or 3 days a week, you know, you will have seen it. We will all have seen that the sort of stress that parents have trying to sort of give a biscuit to appease a child whilst they're on a Zoom call, etc., etc. This should be about the child as much as parents. Yeah,
absolutely. But clearly, I mean, coming back to you, Ros and Joeli, the childcare challenge is one of the barriers to parents getting back to work. And, you know, Joeli, you've got a petition calling for an independent review into the long-term funding and affordability of childcare. Can you just describe a little bit why you think that's needed and what you're hoping would come out of such a review? What issues would need to be considered?
Yeah, sure. So we have the second most expensive childcare system in the world, and our research shows that 40% of mothers, working mothers, either just break even or they're paid to go to work. I mean, that is ridiculous. Save the Children did some research in 2017 that found there are 870,000 stay-at-home mums who want to work but can't, purely because of the cost and availability of childcare. That's half of all out-of-work mums. We know that the funding to the childcare sector is not good enough, and you know, Neil's work has helped to highlight that. We know in 2015, OECD data showed that only 0.1% of UK GDP was spent on childcare, and the average across the OECD countries is more than double this. So we're not giving enough money to our childcare sector, and it is affecting the affordability and the availability, and it is children in areas of deprivation who are being the worst impacted. So we want this independent review to show us whether the current funding model is fit for purpose. Do we have availability issues? Is the system affordable for all parents? And related to that, is the funding provided by the UK government to the childcare sector in line with other countries? And could further investment improve the outcomes for children? And all we keep hearing from the government is, there's nothing to see here, there isn't a problem, we're giving you loads of money, please go away. And so this review will prove that that's correct. All we're asking for is the information. All we're asking for is for them to really evaluate whether what they're saying is true and show us their calculations, show us that research.
Okay, thank you. And from your perspective, Neil, presumably you'd be keen for a review that will demonstrate that everything is rosy in the garden.
Of course, because, and you know, well, I have to go back to government has already done its review in a way, I have to say. So, and it's exposed that for every hour of childcare, it pays £2.60 less than it should do. So, you know, I think what it actually will take, and I've said this before, I mean, the defense of the Freedom of Information request, for example, was, well, this is historic, you know, and since then we've invested 66 million and another 44 million, et cetera, still leaves us at £4.95, not £7.49. So there's still a big shortfall. But I would say, you know, my recommendation would be this really, is that this was not on the watch of the current Secretary of State. This was not on the watch of the current minister responsible for early years. And they have the opportunity to continue to be complicit in this shameful approach, or to switch on their moral compass and do something about it. Because until at this point in time, pretending it doesn't exist helps absolutely no one. And talking about, well, there's no market failure. These are terms that, government shouldn't be using. Good managers don't wait for market failure. They prevent it. They intervene. So they should do something now. So yeah, I would support Joeli 100%. I'm just slightly skeptical of what will come forward.
Okay, and then in terms of parental leave and pay, back to you, Ros and Joeli. The government's due to publish its results from its review of options. What changes are you hoping to see come out of that? Shall I come to you, Ros?
We expect the evaluation to show that take-up of shared parental leave has been extraordinarily low. In our opinion, the shared parental leave policy is a failed policy, and I think it'll be very difficult for the evaluation to show anything other than that. What we need to replace it is a system which is simple, which is based on individual rights rather than shared arrangements, and which is available to all working parents, including those in insecure work and in self-employment. We need a scheme that recognises that there are different purposes for maternity, paternity and parental leave, protects the existing rights of mothers for leave to recover from the birth, and also gives both parents a substantial period of leave to care for their new baby. It needs to be a scheme which substantially increases the very low rates of flat rate of pay for statutory pay, maternity, paternity and parental pay, given that the current rate is roughly half the legal minimum wage for a 35-hour week. We should be increasing that substantially. But I think also in that scheme, we need to address the very unfair and different treatment of maternity allowance under universal credit, which is a shameful situation that we've been waiting for the government to address. It leaves many low-income families with up to £5,000 less in income in their child's first year. This doesn't need to wait for the shared parental leave changes to come through, but should be dealt with as part of that. So a substantial reform based on the principles I've outlined should address the problem of very low take-up and consequently the very gendered nature of care in the first year and subsequently.
Joeli, I don't know if you wanted to add something to that, but I was also going to ask, you mentioned there, Ros, about the low levels of funding for shared parental leave, which is, as you would see, part of the challenge. There's also a report that we identified in our report last year that many mothers return to work before they've taken their full maternity leave period. And, one question I would ask is whether you think the government should be doing more to ensure that parents take their full entitlement, and presumably that comes down to the financial support that's available from the perspective that you've seen it.
Sorry, was that for me, the question, Cathy?
Yeah.
Yeah. It's all the evidence says that financial concerns above all else determine how long women take in maternity leave, and that's pre-pandemic. But financial considerations are partly about rates of pay and benefits and so on. Obviously, women are forced back to work early if they can't afford to take the leave. But there's also the risk to job security, which I think needs to be understood as an integral part of a leave policy, because if you're scared you're going to lose your job, that's obviously a financial consideration. And right now we can't guarantee that women won't find themselves unfairly selected for redundancy while they're on maternity leave. In fact, we know that's happening to an extraordinary degree. But similarly, I think fathers are unlikely to take leave if they also face those risks. And so we need to see an understanding of that full framework of support for parents to retain their jobs during their childbearing years as an approach to replace the shared parental leave model.
Okay, so support and the change to the legal framework as well. Joeli, did you want to come in and add anything on that? And also just generally any final comments, because we're going to wrap up this session soon.
Yeah, very quickly. So there are, from our perspective, 6 key issues with shared parental leave. It doesn't work for the self-employed. So self-employed dads have no legal right to paid paternity leave whatsoever. It's ridiculously and unnecessarily complicated. So we hear stories from fathers who ask to take shared parental leave, and that because the HR departments don't understand it, they're put off from taking it. It needs to be a day one right, and it's very badly paid, as we've discussed. So we know that a quarter of parents get into debt during maternity or paternity leave. And in 2015, the OECD published a comparison of public expenditure on maternity and paternity leave across 34 member states, and the UK came very close to the bottom. It was number 26. So we often hear from the government how generous it is. Yes, it is in terms of time, it's not in terms of money. And that has a really big impact on the fact that parents return before they're ready. It's shared parental leave, not shared parental leave at all, it's shared maternity leave. So you need to ring fence it for it to actually work. And finally, it doesn't work for those who adopt. I do just want to, before we wrap up, because this is my biggest book pillar at the moment, talk about vaccines for pregnant women. We did a poll on Friday with 9,000 pregnant women, and only 21% have had both doses of the vaccine. 41% have not had a single dose of the vaccine. And as we've talked about, this is a vulnerable group of women who are more likely to end up in ICU if they become infected. Their baby is twice as likely to be stillborn if they become infected. This problem could have been solved much earlier had the government prioritised and considered pregnant women. So firstly, they should have been prioritised with the vaccine as soon as we knew that it was safe, and we had the data to show that they weren't, and they're still not. Even when we said pregnant women could have the vaccine, it took another month for the JCVI or whoever was responsible to update the system so that pregnant women could book it. There has been no clear information on the risks and benefits for pregnant women. So with this vacuum of information, it has been filled with misinformation, and we are being inundated with women who believe that the vaccine will cause them to have a miscarriage or other fetal abnormalities. It needs to be part of the process. Midwives need to understand the information, and they need to be giving pregnant women clear and concise information at the right time to give them informed choice about taking the vaccine, because otherwise we're going to see some real tragedies now that the world is opening up and pregnant women are being forced back into the workplace and the Delta variant is running ravage. So this needs to be dealt with really, really fast, properly and thoroughly.
Okay, thank you, Joeli. So, I mean, that's all we've got time for. I think we've covered a huge amount this morning, and I can't thank you enough for your time and also the really important information that you've given us today. Obviously, we're going to give it all a lot of consideration and see how best to process it in terms of being that voice for the petitioners that are raising these issues with us. So thank you very much indeed. Order, order.
Committee.
The proceeding has ended.